Hi, I'm Doctor Mayank. I'm a board certified plastic surgeon and a diplomat of American Board of Hair Restoration Surgery and founder of Crown. We have had this series of male pattern baldness where we have been talking about different grades, which comes under the Norwood classification. But for some reasons, in today's date, we see a lot of our patients suffering with diffuse pattern hair loss. What exactly is diffuse pattern hair loss? Let's talk about it. And if you're suffering with this kind of a pattern, it doesn't classify under the typical Norwood grade. So we would be in a position to talk about all the details of it. So when we talk about a diffuse pattern hair loss, you will see some amount of recession, some amount of loss of the hairline, but a lot of gaps in between the existing hair. Like in this gentleman, you would see that the hairline is not totally disappeared. He has the follicles right here, but there are gaps which have come in between the hairlines. Now this pattern has some advantages and some disadvantages. The advantages is that normally in a hair transplant, you would not have the natural looking densities. You would not have a per square centimeter density of what you had naturally before your transplant, or maybe even before you have lost the hair follicles. What you need to understand is that in this diffuse pattern hair loss, we are placing follicles in between your existing native hair. In such circumstances, the kind of densities that you can achieve is much more fuller. Now, what is the demerit of this? The demerit of this is that because you have to place the follicles in between the native hair, it has to be done with extreme precision. So the surgeon has to be extremely qualified and experienced to do this job. If you see that a person is telling you that we cannot do a hair transplant like this, or we should not do a hair transplant like this, or doesn't have the experience, and you're going in with a hair transplant with similar kind of a surgeon or a technician based clinic or a non-qualified person, in that case, they can cause extensive amount of damage to your native hair while placing these follicles in between. Another disadvantage of this grade of baldness is that your native hair, which were there in between the gaps, are the hair which are already giving you the pillar to form that kind of a result that you're going to get out of the process. So in all diffuse pattern hair loss patients, unless the gaps are extensive, we always advise that you should consider going in for medications. Medicines do add some amount of thinning, because in diffuse pattern hair loss, you will see on the trichoscopic evaluation, there would be some follicles which will be thinned out and are still alive over there. You cannot damage those hair follicles and place more follicles on top of these follicles. So it's always advisable to use medicines. Maybe the medicines and medical therapies give you some amount of coverage for this kind of a grade without a transplant. We have had several patients who have come to us in the similar grades of baldness looking for a hair transplant to us, but genuinely when we do the trichoscopic evaluation and we see they are actually not candidates for a hair transplant, they are candidates for good medical management. So determining whether you are having a diffuse pattern hair loss and whether you are actually a candidate for a hair transplant is also very important. So never try to send pictures of this kind of a baldness to the surgeon or the clinic where you just click and send and say that what is the number of grafts or follicles that I'm going to require and what is the cost that is going to be coming for this procedure. The candidature of a hair transplant is something which we need to be very sure about for this kind of a pattern, and your usage of medications after the surgery is extremely important. So be very sure that whenever you have this kind of a pattern, always get in touch with a plastic surgeon or dermatologist and make it sure that you undergo a trichoscopic evaluation to determine whether you are genuinely a candidate for this or not. Now let's talk about few cases. Like in this gentleman at close to around 30 years of age with diffuse pattern hair loss, with trying medications previously, we have given the framework to the face because that framework was missing, and covered the gaps of the front and the mid area also simultaneously. So you can see the hairline has been just created in the areas where he had that illusion of the hairline that was there for him before he had lost more hair. We have not tried to make the hairline go very low and have created that with an irregular pattern of single follicles, making it look beautiful and natural. Similarly, on the other side also, we have just gone into the traces of what hair he already had. Bringing this hairline low is not very difficult. It is a very easy job to do. Clinics may push you towards it as well because they would want that the hairline is made to be low, and then accordingly you can place more number of hair follicles into the same area, proportionately increasing the finances of the surgery. But be very sure, don't do that, because this is the kind of boundary line that you're creating for the life. And if this boundary line stays here and you lose the volume in the hair beyond this area, you will require more number of hair follicles to cover that area, much more than what you would have required just a centimeter higher hairline. So always go with a conservative approach. Try to fill up with a beautiful density so that you get the kind of illusions that you have a head full of hair. This is the top view of the same gentleman, covered from the front till the crown. And we have not transplanted this area at all. This was his native hair, which you are seeing here, and we have just covered the gaps from the front till the midsection. And this also has been done very conservatively, preserving his donor area for the future life as well. Another patient with a similar kind of a grade of baldness, which is a diffuse pattern hair loss, tried with medications, did not help. The major gaps on the folliscopy were not getting covered up at all, and the patient wanted the redefinition of the same areas. So we did a transplant at someone who was close to around 28 years of age, but putting him on medication simultaneously to prevent further losses as well. So a person who has used medicines over a period of time and has got fatigued or given it up that okay, medicines is not working for us, is also a candidate after a transplant to use medicines to preserve the native hair what the person has before the surgery. So this is the top view of the same person. You can see that the scalp over this area is wet. This is because the patient came with the minoxidil application on the head when he came for the follow-up. But again, even with this wet look, you would not be in a position to see extensive amount of gaps. With dry combed over hair, obviously there's no gap that usually comes as a visible area. Another gentleman where he had a diffuse pattern hair loss, tried medications, did not work. The folliscopy was representative of extensive amount of gaps where we have just rectified the density and given the illusion of a good looking natural hairline. Similar kind of a case where there was some amount of forelock retention pattern and the rest was all diffused hair. Forelock retention pattern gives you an advantage where you would have this area already there. So the native hair what you have to merge the hair around it to make it look natural, and then obviously it merges beautifully and blends into the existing native hair, which gives you a complete coverage as well and makes it look natural. The side view of the same gentleman and the other side view. So this is something about a diffuse pattern hair loss. If you're suffering with this kind of a hair loss, what I have told you, I'm going to summarize. Always consult your plastic surgeon, dermatologist or a hair transplant surgeon. Go meet them in person, get the trichoscopic evaluation done, see what exactly are the kind of results that could have been delivered with medications alone for you. And if there is no miniaturized hair and there are major gaps and you've used medicines for an extensive amount of time, then you may consider a hair transplant. If you're not at a very young age, if you have crossed an age of 28 or 30 years of age, then it makes sense to do it unless it is impacting you extensively. Your discipline and the usage of medications post-surgery become very imperative. You cannot give up on the medications at any level, and you have to be open to going in for more than one hair transplant, because the native hair what you had before the transplant, where we are placing the hair follicles in between the gaps, those hair will continue going over a period of time. The moment they kind of disappear from your scalp, you will require additional hair follicles to get the similar kind of densities that you would be used to. I hope this video makes sense to you and has helped you. If you're suffering with this kind of a hair loss, do get in touch with us, contact the numbers given below, and we would see how we can help you out. If you've liked this video, please give us a thumbs up and do subscribe to the channel for similar content. This is Dr. Mayank signing off. Thank you.